Which of the following echo findings would be most likely found in this patient? A 53-year-old woman visits a physician with complaints of shortness of breath and fatigue over the last few weeks. Her past medical history includes hypertension for the last 20 years. She takes hydrochlorothiazide and losartan daily. Her mother died at the age of 54 from a stroke, and both of her grandparents suffered from cardiovascular disease. She has a 13-pack-year history and drinks alcohol occasionally. Her blood pressure is 150 over 120, pulse is 95, respiratory rate is 22, her temperature is fine. On physical examination, she has bibasilar rales and distended jugular veins, pitting edema in the both lower extremities. Her pulse is irregularly irregular, important finding, and her apical pulse is displaced laterally. Her fundoscopic findings are described as copper wiring and cotton wool spots. What do you think is the problem here? What is her diagnosis and what would the echo be? So she has hypertension, right? So that hypertension would lead to hypertrophic cardiomyopathy, and hence she's developing heart failure. Okay. Now, what are the classic findings of heart failure here? She has shortness of breath, she has fatigue, she has bibasilar rales, she has distended jugular veins, she has pitting edema, right? In addition to that, see, she has a history of hypertension earlier, and she was taking 2 drugs for them. She was taking hydrochlorothiazide and she was taking losartan. Also, look at her fundoscopic findings. She has copper wiring and she has cotton wool spots. They're actually signs of hypertensive ophthalmopathy. So in this patient, what would your option be? Oh, okay. When is the ejection? What is the normal ejection fraction, and after what ejection fraction do you say that the heart is failing? You should know this. So why do we have left ventricular hypertrophy in chronic hypertension? Because of the increased afterload. Okay, so in hypertension, what happens? Your vascular resistance increases, right? So the heart has to pump against increased vascular resistance. Okay, so because of that, there is hypertrophy in the ventricles because it needs more strength, and hence there is left ventricular hypertrophy. Crackles and rails is the same thing, Kritika. It's more of an American and British thing. So in US you get more rails, and in British English we say more crackles. So 65, right? 65 is normal, and less than 55 is what is considered as heart failure. Okay, so in this case there's only one option with an ejection fraction of less than 55. That's option A. In addition to that, it is signifying increased left ventricular wall thickness, which is a characteristic of your hypertrophic cardiomyopathy. Where else? Tell me one other condition where you will have hypertrophic cardiomyopathy. HOCM is nice, like hypertrophic obstructive cardiomyopathy, like hypertension. We have already read this was hypertension. Which murmur? Not AR, Aditya. You're close, but it's not AR. Think what will increase the afterload. Now the heart has to pump against increased afterload. So you see it in hypertension, and you see it in, what is the type of hypertrophy? Yes, it's aortic stenosis. Okay. Are the fibers in parallel or are they in series? The new fibers in hypertrophy. Very good. They're in parallel. And where do you get them in series? In dilated cardiomyopathy. Very good. 3 risk factors for dilated cardiomyopathy. We read for the 2 most common risk factors for hypertrophic. That's aortic stenosis and that's hypertension. Tell me for dilated cardiomyopathy. Alcohol, very good. And vitamin B1 deficiency, right? And also, yes, Coxiella can cause it. It's not Coxiella, it's actually Coxsackie. It's not Coxiella. What are the other signs of hypertension in hypertensive end organ damage? You have encephalopathy, so you'll have thickening of the cortical vessels. Also, it can increase your chances of stroke. Hypertensive nephropathy, right? You have, what is the characteristic finding of hypertensive nephropathy in your pathology? So in renal pathology, what will you see in hypertensive nephropathy? Classic appearance, very high yield question. No, I'm talking about the hypertensive nephrosclerosis. What is the appearance? It's actually the onion ring appearance. Okay, so you have the onion peel appearance in arteriosclerosis. Rings a bell in hypertension? Or did you not read nepropharma yet? or nephropath yet. It is nephrosclerosis, and you have onion peel appearance in hypertensive nephropathy. So in retinopathy, we've already talked about its copper wiring, and you have cotton wool spots. So prolonged hypertension can cause all of these damages, and hence you need to make sure that you're taking care of your heart, right? So what is option C here? Regurgitant aortic wall, so it's AR. Dilated chambers, this is dilated cardiomyopathy. And what is early diastolic filling and late slow diastolic filling? This is actually rapid early systolic and late diastolic. This is a typo here, so just correct it.
Thanks for watching. Please give a thumbs up and subscribe for more.